Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Homeopathy. Today we will look into one of the important topics, investigations that you have to do for HIV or AIDS. Lot of people have multiple questions on this. We will address each and everything. So there are a lot of tests that you can do for HIV. PCR, antibody test, antigen test, ELISA test, Western blot test. There are a lot of tests. Every day new test is coming, but the basic principle is same. There are three things you can identify to detect HIV. One is viral RNA. You can detect the RNA of the virus in the blood of the person, or you can detect the antigen, especially P24 capsid protein. This is one of the proteins that is present in the nucleus of HIV. And also next one is antibody. When your body reacts against the antigen, antibodies are produced in your blood. Any HIV test you take, you will be detecting either viral RNA or antigen or antibody. So what is the sensitivity when you can detect this virus or antibody or antigen in the blood of a person? The most sensitive test is detecting the viral RNA. In about 50% of the cases, for example, if 100 people are infected by HIV, in that 50% of the people, HIV RNA can be detected from 15 days to 10 days. So in about 99% of the people, it can be detected after 30 days. So if you are doing PCR test or viral RNA test, it should be done after 10 to 15 days. It will be positive in 50% of the cases. In almost 99% of the cases, it will be positive after 30 days of infection. And coming to antigen detection, antigen here is P24 capsid protein. This protein in 50% of the patients after exposing to HIV can be detected after 15 to 20 days. After 45 days, it can be detected in 99% of the cases. And coming to HIV antibody, in 50% of the cases or 50% of the patients after exposing to HIV, this can be detected after 20 days to 30 days. In 99% of the cases, it can be detected after 90 days. That's the reason, depend on your stage, depend on your economic status, you should be doing all these tests, but you have to understand which test you have to do at what stage and what is the sensitivity. With this you will understand what type of HIV test has to be done at what stage of the disease, at what duration of the disease. This is very important for you. And when you are a HIV patient, you have been suffering from HIV, so at what time you have to do the viral load test. Viral load test has to be done every 3 months or 6 months. It will detect the virus in your blood. Even though the virus in your blood is 0, when the viral copies falls below 40 to 70 per ml of blood, it cannot be detected. You should not be considering this as HIV is completely cured, because the viral load test will be done for the virus in the blood. There is high chance that you will have virus in your blood or in your semen or in the breast milk. We are not checking for those places. We are checking the viral load only in the blood. It has to be done every 3 months and 6 months. And coming to the CD4 count, CD4 count has to be done every 3 to 6 months. When the CD4 count is below 200, it means you are at higher risk of getting any infectious diseases, and it is danger zone. If your CD4 count is above 450, it can be considered that you are in safe place. So always ensure that your CD4 count is above 450 and it should never come down below 200. These are all the tests you have to do on a regular basis or one time basis for HIV.
Homeopathy.